and welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart, and today I'm joined by Dr. Rabia Buridi. Thank you so much for being with us today.
And thank you for having me.
Yes. Dr. Buridi is a vascular stroke neurologist that I get to work with here, so she's one of my favorites. And I'm really excited to talk to you about women and stroke today.
It's an important topic.
Exactly. And, there's a lot of people we see close to our age, young mothers with children that are having strokes, especially. And so we are personally invested in finding answers to these questions. So if we don't cover one of the questions you have in this episode, make sure you leave in the comments what your question is, and we'll try to include that in part 2. So the first question is, how common is stroke in women, and how does that compare to men?
So when we look at our statistics, stroke is the second leading cause of death for women worldwide. For men, it's the third leading cause of death worldwide. So it's slightly more common in women compared to men. So we say about 1 in 5 women will have a stroke in their lifetime. And for men, it's about 1 in 6. Pretty close, but slightly more common in the women.
And do they have the same cause, or are there different causes of stroke in women and men?
It's a good question. So across the board for both men and women, high blood pressure or hypertension is the number one cause. But when we look deeper into that, there are different causes of hypertension that may differ from men and women, which could further cause strokes in different age groups in men compared to women.
And then are women more likely to experience certain types of stroke? Like there's ischemic, which is caused by a lack of circulation, hemorrhagic, which is a bleed. Are women more likely to have one kind than men are of the other?
So the most common type of stroke is ischemic stroke, like you talked about. So lack of blood flow. About 80% of strokes are categorized in the ischemic category, and the other 20% are hemorrhagic, so too much blood. Women are more likely to have ischemic strokes just because they're more common. But when we look at the rate of hemorrhagic strokes, women are also more likely to have those compared to men.
Okay, so women are more likely to have a brain bleed than men are.
Correct. Okay. But the causes may not be what you think.
Yeah. And so we'll get into that some more. How do particularly hormonal factors like pregnancy, birth control, and menopause influence stroke risk in women?
That's a very good question. And it's something that I don't think a lot of people know about in the general public. So pregnancy is the most important and I would say dangerous time for a woman because of all of the fluid shifts that are happening, all of the hormonal shifts that are happening. We do know that the rise in estrogen can contribute to clot formation, which can raise your risk of having both ischemic strokes and hemorrhagic strokes as a result of having clots form in our veins called cerebral venous sinus thrombosis. So the women that are more at risk are the women that are pregnant and postpartum.
And can you explain, on a different note, the relationship between migraine and especially migraines with aura and the stroke risk in younger women?
Yeah, absolutely. So we do know that migraine with aura does raise your risk of a stroke within your lifetime. Now, the reason behind that is not entirely known, but we believe it has to do with the fact that when an aura is starting to begin, it changes our vasculature. And it causes what we call endothelial dysfunction. So dysfunction of the inner lining of our blood vessels. And as we know, stroke is a blood vessel problem. But it's not that if you have migraine with auras, you're going to have a stroke. It's usually not the case. You have to have other hits with it. So the ones that we tend to educate women about that do suffer from migraine with auras is to not smoke, because smoking furthers your stroke risk. It further damages our arteries. And then if you add to that hormonal birth control, like estrogen-containing birth control, that will even raise your risk further. So if I have a young woman coming to me in my stroke clinic and she has a history of migraine with aura and a stroke history, I tend to ensure that she finds alternative birth control options that don't necessarily contain the estrogen. And so it tends to be a conversation between me and the OBGYN department.
Excellent. And I'm really thankful that you're able to follow up on that trail because, like you said, it's not one size fits all.
That's correct.
But it's also not that mysterious. We just have to ask some follow-up questions and make sure we know what the ingredients are in the medications we're taking so that we're not causing these dangerous combinations.
Absolutely.
So, what should women know about how high blood pressure during pregnancy, like preeclampsia, affects stroke risk later in life?
Yeah, so with preeclampsia, so it's essentially when the blood pressure starts to climb at any point in the pregnancy. Most commonly, it's either before or after 34 weeks. If you tend to have the diagnosis of preeclampsia before the 34-week mark, it tends to cause more longer-term damage because you can imagine that when you have blood pressure that's running so high in what we call our emergency numbers, it will damage our blood vessels long-term. And so the statistics are that if women have preeclampsia before the 34-week mark, they're more likely to have a higher risk of stroke even within that 10-year window after she gives birth.
Wow.
Yeah.
So not just at the time she's pregnant,
that is correct.
not just at the time that she's giving birth, but up to a year later?
Up to 10
years later?
Absolutely, yep.
What in the world?
Yeah.
Do we know why exactly that is?
It has to do with the damage that happens to the blood vessels as a result of that, having that high flow during that time while she's pregnant.
They just need that time to heal,
Correct.
essentially?
And they are also the women that are more likely to have high blood pressure after delivering. So these women need very close monitoring, follow up with their primary care doctor. And honestly, they should have a cuff at home to make sure that they're running normal at home. And just those routine checkups are very, very important. So it's a hot topic that I think a lot of women don't realize that, preeclampsia, even though you're 25 years old, it can raise your risk of a stroke 10 years after.
Yeah. And then 10 years after you're 25 years old, you're only 35.
Yeah.
So I know if you're having a baby at 35, they might refer to you as like a geriatric pregnancy.
That's correct, yeah. I think that's what it's called now, yeah.
Right. But still, if you have a stroke in your 30s, like that's still really young. And that can have a lot of different kinds of challenges than when you have a stroke when you're older, because you kind of expect people to have strokes when they're older. But like you and I are both young mothers of young children. So seeing these women come in who have experienced a stroke at our age is very sobering. And we're very invested in doing what we can to prevent stroke at our age currently, and also let other people know to be watching out for it. I know when I go in to do community programs about looking for the signs of stroke and when to call 911, there are a lot of interested people attending that are retired and older, and not so many younger people know that it really applies to them.
Yeah.
And so I think the more we can talk about this and let people know that your age does not necessarily mean you're in the safe zone.
That's correct.
To know your own risk factors, like you were talking about. Are you on hormonal birth control? Do you have a family history? Do you have high blood pressure?
Yeah.
Like, how many times have you gone in a patient's room and they said to you, I didn't have high blood pressure and diabetes till I had this stroke?
Yeah. A lot of them, the symptoms aren't that obvious, right? So they may not even know it until they're going in to have that baby, or they're going in just for their checkup for their work, So it's important to do those follow-ups, to keep an eye on things, to make sure, like, oh, maybe I'm not feeling too good. I have a headache today. Maybe I should check my blood pressure to make sure that it's not too high. And try to focus on those preventative techniques, and try to stay as active as you can, maintain that healthy lifestyle, that healthy diet that's well balanced, and things like that. Try to ease the stress in your life, which is easy to say, but all of these things are very helpful. in lowering our risk of stroke and heart attack long term.
Exactly. And if you're listening to this and thinking, well, I wish I could eat healthy, but have you seen the price of food these days? We do have another episode of the Stronger After Stroke podcast recorded with a dietitian who talks about how to eat for your brain health, which would be for stroke prevention, for any budget, how to make the better choice out of, like, if you're choosing between canned foods, choose the one with the lower sodium, for example, or, and we have a printout attached to that as well with kind of guidelines of when you're in the grocery store, what to look for and how to make those decisions in a more like general way that's not as overwhelming as you have to eat these expensive list of foods, right? So definitely check that out. And if you can find a primary care doctor near you, then you definitely should.
Yeah.
If you are in the Louisville, Kentucky area, we'd be happy to introduce you. So feel free to reach out to the Norton Neuroscience Institute Resource Center as well about that. Now, Dr. Buridi, let me ask you, is there anything that you feel like you wish everybody knew about women and stroke?
The one thing I would say is that women may present differently. They might not present with the typical stroke symptoms that we're educated on, like the FAST acronym, right? So the face, arm, speech, time. There are some strokes that present with confusion. You may not even identify it as a stroke risk or a stroke sign because they're not presenting with that facial droop. They're not presenting with weakness on one side of the body. And another presentation that we see more commonly in our younger females are seizures.
Seizures.
Yeah. And these are the ones that unfortunately are either pregnant or postpartum or on the birth control. And men can have it too. We've seen it in men, but it tends to be more common in females. But they'll end up having a blood clot in the veins of the brain. We call it a cerebral venous sinus thrombosis. And it commonly presents with seizure.
Wow.
And so then they end up getting the medication for seizures. And then after we get that head CT, then we're like, oh, there's something more going on. So, it was this caused the seizure, not the seizure caused the clot.
Yeah. Whereas, and then sometimes strokes that are brain bleeds can also cause seizures as well later on, right?
Absolutely.
Not as an initial symptom, maybe.
Yeah.
But
once the scarring process is over, you're more likely to have seizures down the road with those larger strokes, of course.
So there can be a lot of overlap. So if you are seeing a neurologist and you see all this list of 10 different things that these different neurologists specialize in, there is a lot of overlap, but there is also a lot of things you can specialize in. So thank you for using your time to specialize in stroke and how to keep our blood vessels healthy, to keep our brain healthy.
Absolutely.
It is very needed. Stroke is the #1 leading cause of disability in the world.
Yeah.
And that can be really debilitating, especially for women, because I feel like if a woman is the caregiver and she has a stroke, then all these people who were depending on her, she needs their support or they need to reach out to other resources.
Yeah.
Maybe other women in their life sometimes. And that can be hard, but that's something we cover on this podcast quite a bit as well, is how to have those conversations when roles are changing. And that happens a lot when women have strokes, is that role reversal situation.
Right.
So,
and women tend to outlive men, which makes their lifetime risk of a stroke higher because they're living longer, frankly. And so it's also difficult to pick up those stroke symptoms in the really elderly females because they tend to have other medical issues going on at the same time. So things could get clouded just a bit with that.
Yeah. So we got to watch out for the other women in our life.
Yeah.
We need each other.
That's true.
Now, I believe I saw this study and you correct me if I'm wrong, but that women live longer when they have really good other women friendships. Have you
I would
seen
believe
that?
it. No, I don't think I've come across that,
It
but
wasn't
I
it
would believe
wasn't in
it.
the stroke journal, so we'll
No,
let you
but
off on that one. It was something more like sociology type related. But yeah, that connection that we have to other people,
yeah,
it really does come into play
right.
after somebody's had a stroke. You want to have those people
Oh,
you can
yeah.
rely on. So
And that helps with the disability that comes after as well. Like that emotional support that you need helps with the post-stroke depression, the post-stroke anxiety that happens so commonly with patients. Because if they have enough support and that issue is addressed, then it helps their recovery. Yeah.
exactly. Exactly. Well, thank you so much. And if you've enjoyed this episode of the Stronger After Stroke podcast, be sure to give it a like and subscribe wherever you're listening or if you're watching on YouTube. And let us know if you learned something. And remember to comment if you have any questions, especially about women in stroke that we didn't cover here, so we can hopefully address that in part 2 with our other female vascular neurologist. And I'll see you in the next episode.
Thank you, Rosa.
Thank you, Dr. Buridi.